If we could go ahead and get our first presenter. Dr. Boyce will present on public perceptions on robotic surgery, hospitals with robots, and surgeons that use them.
My name is Josh Boyce from the University of Southern California, and like I said, I'll be presenting on our public perceptions of robotic surgery. One of our authors is a paid instructor for Intuitive Surgical. Robots were first introduced into the operating room in 1985. These first robots held laparoscopic cameras and retracted. With the introduction of newer robotic systems, such as the Da Vinci system, the robots started to first interact and interface with human tissues, actually cutting and sewing. Since 2000, when the FDA approved the Da Vinci robot, there's been an exponential increase in the number of robotic procedures performed worldwide annually. However, the public perception of robotic surgery is not well known. So our aim was to assess public perceptions of robotic surgery, hospitals that have robots, and surgeons that use them. We performed a web-based survey, 24 multiple choice questions with an option for free text on some of the answers. The link was distributed worldwide by email and social media from July to September of 2014, and we excluded surveys for less than 50% survey completion. We excluded 4-day-2 surveys, leaving us with 747 for analysis. The mean age was 38.5, with the majority being females. 92% had a college degree or higher, and 94% of respondents were from the US. However, we did have 16 other countries represented in our sample. The occupation of the respondents, 53% were healthcare workers, with 13% being physicians. The others made up a wide variety of occupations. When we asked them about the global perceptions of robotic surgery, the majority, 86%, had heard of robotic surgery, and 78% thought it was similar to laparoscopic or minimally invasive surgery. However, 22% did think that robotic surgery was most similar to open, laser, or scarless surgery. And 21% indicated that some degree of autonomy by the robot during surgery was there. 72% of respondents, when asked about advantages of robotic surgery, thought that it was safer, faster, less painful, and/or produced better results. However, when we asked them if you needed surgery versus robotic surgery or conventional minimally invasive surgery, only 45% actually said they would prefer robotic surgery. This discrepancy between these are likely multifactorial. Some of the concerns the respondents had about robotic surgery, the majority thought the robot or were concerned that it could malfunction, causing internal damage. And 15% thought the robot actually did the wrong operation. 18% had other concerns. We asked our respondents about hospitals with the robots and robotic surgeons. So worldwide, 50% thought that hospitals with a robot were actually better hospitals. But only 26% thought robotic surgeons were better surgeons. An additional advantage of robotic surgery is its ability to perform remote surgery. So we asked our respondents, if you were having robotic surgery, which would you prefer? A world-renowned expert surgeon you've never met operates from a remote location. Or B, a non-expert you met does the surgery on site. 50% chose the expert they had never met to perform the robotic surgery. So in conclusion, most were familiar with robotic surgery and associated with improved outcomes. Less than half would choose to have it over conventional minimally invasive surgery. Misperceptions about robotic surgery are common, indicating the need for public and patient education. And finally, interest in remote surgery should be explored as a potential option for utilizing high-volume expert surgeons for complex procedures without having to regionalize care to locations far from the patient's home and support system. Thank you.
Any questions from the audience? I have a question to start off with. How much did the demographics shape these opinions? In other words, were there big difference between males and females, or I'm actually more interested in based on the age of the respondents?
Yeah, so one of the advantages of this is that we did have a large enough population that we could do subgroup analyses. Females, interestingly, actually had perceived more advantages, but they also had more risk, and they were actually less likely to choose robotic surgery over males. Some people might say that that has just might be differences based on the way we weight risk and benefits, but you know, we never explore that in this survey. And then by age, there were a few differences. The younger age group had heard about robotic surgery a little bit more, but as far as choosing and some of the other major misconceptions, they were actually pretty even.
Okay. Question.
Danielle Molina from Baltimore. I'm curious to know if you looked or asked the patients where, since there are not a lot of healthcare workers, where did they get the information about the robot? Where did perception of what robotic surgery is comes from for patients?
Yeah, you mean from non-healthcare workers?
Yeah, in general, probably, you know, the healthcare worker, I'm sure there are, you know, there's a lot of marketing going on. So I'm curious to know what patients that are not, other people that are not in the healthcare world, where they heard about the robot.
Yeah, we gave them options, you know, a friend, television, internet. The top two was someone they knew and the internet.
Okay. Yeah. That's interesting. Yes, sir.
Hi, I think that's a fantastic study, most needed at this time. There is a, my question is more philosophical. There is a sort of an anti-robot in the public media, especially look at the New York Times. They've published at least 2 articles saying that, you know, that this is not good and it's costing us a lot. How do you think we should go about changing the perception at that level?
From the media, well, you know, there's a paper out there by Jen and others that talks about hospital advertising. So, you know, there's advances in marketing from the hospital aspect. I mean, the public perception actually, I think, has a relatively favorable perception. And I think we can all agree that most of the people that walk into our offices have a pretty low healthcare knowledge in general, and really it falls on us to educate them and really kind of tackle it when they come to us. There's other things, you know, when it's just kind of opens a bag of worms in that sense when you start dealing about marketing and stuff like that. So it's really complex, but I think it needs to be addressed.
How were the surveys distributed? In other words, was this just a purely local thing? Was it a mail? Was it an internet? How was that distributed?
Yeah, so we sent them out to, we all posted it on social media, and then we distributed it within our group, and we asked everybody to forward it on to people and asked them to post it on social media sites. So it just kind of took off, and it was nice to get that many responses.
Good. All right. Thank you very much. That was tremendous. Thank you.